Hello everybody, this is Caafimaad here. This video is about diabetes. We will review its types, causes, risk factors, and preventions. Diabetes mellitus refers to a group of diseases that affect how your body uses blood sugar, which is glucose. Glucose is vital to your health because it's an important source of energy for the cells that make up your muscles and tissues. It's also your brain's main source of fuel. The underlying cause of diabetes varies by type, but no matter what type of diabetes you have, it can lead to excess sugar in your blood. Too much sugar in your blood can lead to serious health problems. Here we will study the types of diabetes. Chronic diabetes conditions include type 1 diabetes and type 2 diabetes. Potentially reversible diabetes conditions include prediabetes and gestational diabetes. Prediabetes occurs when your blood sugar levels are higher than normal, but not high enough to be classified as diabetes. And prediabetes is often the precursor of diabetes unless appropriate measures are taken to prevent progression. Gestational diabetes occurs during pregnancy, but may resolve after the baby is delivered. A blood sugar level less than 140 mg per deciliter is normal. A reading of more than 200 mg per deciliter after 2 hours indicates diabetes. A reading between 140 and 199 mg per deciliter indicates prediabetes. Diabetes symptoms vary depending on how much your blood sugar is elevated. Some people, especially those with prediabetes or type 2 diabetes, may sometimes not experience symptoms. In type 1 diabetes, symptoms tend to come on quickly and be more severe. Some of the signs and symptoms of type 1 diabetes and type 2 diabetes are weight loss, a slow healing, vaginal infections, frequent urination, blurred vision, fatigue, increased thirst, tiredness, extreme hunger, sexual problems, and finally, headache. Type 1 diabetes can develop at any age, though it often appears during childhood or adolescence. Type 2 diabetes, the more common type, can develop at any age, though it's more common in people older than 40. Here we want to talk about types of diabetes in more detail. Blood sugar rises when you eat food. On the other hand, body tissues need glucose for their activity. Body sugar must be available to the cells, and this is the task of insulin, which is secreted from the pancreas. Body cells have receptors for insulin, and their response to insulin is the entry of glucose into the cell. The exact cause of type 1 diabetes is unknown. What is known is that your immune system, which normally fights harmful bacteria or viruses, attacks and destroys your insulin-producing cells in the pancreas. This leaves you with little or no insulin instead of being transported into your cells. Then sugar builds up in your bloodstream. In prediabetes, which can lead to type 2 diabetes, and in type 2 diabetes, your cells become resistant to the action of insulin, and your pancreas is unable to make enough insulin to overcome this resistance. Instead of moving into your cells where it's needed for energy, sugar builds up in your bloodstream. Exactly why this happens is uncertain, although it's believed that genetic and environmental factors play a role in the development of type 2 diabetes too. Being overweight is strongly linked to the development of type 2 diabetes, but not everyone with type 2 is overweight. During pregnancy, the placenta produces hormones to sustain your pregnancy. These hormones make your cells more resistant to insulin. Normally, your pancreas responds by producing enough extra insulin to overcome this resistance. But sometimes, your pancreas can't keep up. When this happens, too little glucose gets in your cells and too much stays in your blood, resulting in gestational diabetes. Here we will review some risk factors of diabetes. Although the exact cause of type 1 diabetes is unknown, factors that may signal an increased risk include family history. Your risk increases if a parent or sibling has type 1 diabetes. Environmental factors. The presence of damaging immune system cells. And finally, geography. Certain countries, such as Finland and Sweden, have higher rates of type 1 diabetes. Risk factors for type 2 diabetes. The first risk factor is weight. The more fatty tissue you have, the more resistant your cells become to insulin. Inactivity. The less active you are, the greater your risk. Physical activity helps you control your weight, uses up glucose as energy, and makes up your cells more sensitive to insulin. Family history. Your risk increases if a parent or sibling has type 2 diabetes. Race or ethnicity. Although it's unclear why, certain people including Black, Hispanic, American Indian, and Asian Indian people are at higher risk. Age. Your risk increases as you get older. This may be because you tend to exercise less, lose muscle mass and gain weight as you age. But type 2 diabetes is also increasing among children, adolescents, and younger adults. Gestational diabetes. If you developed gestational diabetes when you were pregnant, your risk of developing prediabetes and type 2 diabetes increases. And finally, high blood pressure is the last risk factor. But how we can prevent diabetes? Type 1 diabetes can't be prevented. However, the same healthy lifestyle choices that help treat prediabetes, type 2 diabetes, and gestational diabetes can also help prevent them. It includes eat healthy foods. Choose foods lower in fat and calories and higher in fiber. Focus on fruits, vegetables, and whole grains. Strive for variety to prevent boredom. Get more physical activity. Aim for about 30 minutes of moderate aerobic activity on most days of the week, or at least 150 minutes of moderate aerobic activity a week. Lose excess pounds. If you are overweight, losing even 7% of your body weight, for example, 14 pounds if you weigh 200 pounds, can reduce the risk of diabetes. Don't try to lose weight during pregnancy, however. Talk to your doctor about how much weight is healthy for you to gain during pregnancy. To keep your weight in a healthy range, focus on permanent changes to your eating and exercise habits. Motivate yourself by remembering the benefits of losing weight, such as healthier heart, more energy, and improved self-esteem. I hope you enjoyed this video. Thanks for watching.